Um, so I think we can begin. You want to count down, Ryan? Good evening, everyone. This is Joe Core, Superintendent, North County Central School District. Welcome to the summer meeting here of the Parents Advisory Council. Parents Advisory Council is a group of your friends and neighbors, parents, students, and we are joined this evening by Mr. Wager, Mr. James Wager, our new Shaker High School principal as well, and we have administrators who join us in these meetings as well. These are meetings here where the district presents ideas and plans and receives input from this group of parents. And I'd also like to indicate too that
give me the thing.
We also have a email that you can submit questions to. So what I want to mention to you this evening is we are focusing on the opening of school in September, the return to school. We're going to be focusing on those questions specifically tonight. We're going to be providing you with a generic overview of where we are because much has yet to be finalized throughout the region. And we certainly are planning to have further PAC meetings. In fact, we have one scheduled for a week from tonight, Thursday. That would be also at 7 o'clock. That would be Thursday, August 12th. So again, I welcome you all here. I think, why don't we just, we'll take a quick announcement here to everyone here. That meeting is tentative too, and it depends upon where we are in receiving guidance. So, Mr. Wager, why don't you start off in introducing here, and I'll just call on people as we go through.
Hello, everyone. Jim Wager, fourth day on the job at Shaker High School.
Very good. Welcome.
Really excited to be a part of the team and a part of the North County community. And I look forward to working with the teachers, the administrative team, and the kids most importantly, and getting this year off right and just having a great, productive school year.
Thank you, Mr. Wager. It's great to see you. Troy.
Hello, everyone. My name is Troy Sorreo. I am a rising sophomore. I just recently took over the Student Representative Committee, and I am also the rising sophomore Student Board of Finance representative.
Great.
Great to be with everyone tonight.
Great to have you. Dr. Saida.
Hi, this is Dr. Saida. I don't know what happened to my video.
We can see you.
Oh, hi, I'm Dr. Saida. I've been on the Parents Advisory Committee since the inception of it, I think, and I really appreciate Mr. Core and the members of this community, I think, and the participation of the other advisors. And I'm here to help as much as I can. And I have two kids in Shaker High School, so I'm very invested in it. But I'm also invested in North Colony. I love North Colony. I think people in North Colony are wonderful, and I'm very happy to be here.
Thank you. Ms. North.
Hey, I'm Abby North. I'm the principal at Loudonville. Nice to see everyone again.
Brett.
Good evening, everyone. Brett Baxt. Been on the PAC committee. My daughter's going into 7th grade, so 7 years now. So daughter at Shaker Middle and going into 7th grade, and a son at Bout Hills going into 4th. So good to see everyone. Hope everyone's enjoying their summer.
Thank you. Thank you. Tabassum.
Hi, everyone. This is Tabassum. I have a daughter in Bout Hills and two sons now in Shaker High School, so another in high school now. And I am an epidemiologist at the New York State Department of Health, and I
I'm afraid you're breaking up a bit. I apologize for that. But thank you very much for joining us here.
Like the work, and I'm fortunate to have.
Thank you. And we have a number of other individuals here. Kelly.
Good evening, I'm Kelly Brown. This is my third year on the PAC, and I have a rising sophomore.
Thank you. Thank you. Lisa.
Lisa Audie, am a parent of a hopefully rising fifth grader at Southgate Elementary School, who is also a child with special needs.
Thank you, Lisa. Lisa Kennedy.
Hi, my name's Lisa Kennedy. I have a daughter going into fifth grade at Blue Creek and a son going into first grade at Blue Creek. And I joined the PAC in March, so I'm a relatively new member.
Welcome back, Karen Meese.
Hi, everybody. I have a daughter going into 8th grade next year, and I'm excited she'll actually get to go to the middle school. I'm looking forward to that. And a son going into 4th grade at Forts Ferry.
Great. Ms. Skeels.
Hi, everybody. I'm Kathy Skeels. I'm Deputy Superintendent. And I'm glad to see everybody back here tonight. So thank you. It's great to have you here.
Great. Ian, welcome to the PAC.
Thanks. My first meeting, student taught at Blue Creek many, many years ago. My wife went through North Colony, and we have a son, Jack, who's going to kindergarten in the fall. So I'm happy to be here.
Great. And Jennifer, welcome to the PAC.
Thank you, Mr. Core. I'm Jennifer Karen. This is my first PAC meeting. I have a daughter who's going to be a senior, and I have a son who's going to be a freshman. So he didn't get to see the junior high as much as he wanted to, but he'll go back and take tours of it.
Great. Great to know. Mr. Chamberlain, Davis Chamberlain.
Everybody, it's nice to see everybody. Principal of the middle school. It's nice to be involved in this conversation. I'm looking forward to a more normalized year than last year, and looking forward to getting back in our regular configuration. So it's good to see everybody. Thanks.
Great. Casey Barden.
Good evening, everyone. Good to see everyone. I'm Casey Barden, Director of Pupil Services, and it's nice to be here.
And Dina.
Good evening, everyone. Dina Delude. This is my third year on the PAC, and my son is in 8th grade.
Good to have you here. Jenna Myers.
Hi, I'm Jenna Myers. I have a rising 11th grader and a 7th grader, so no more elementary school for us. And I also work for the district at Southgate and Loudonville.
Great. And Sujatha.
Hi, everyone. Good evening. I'm glad to be here. I am the parent of a rising 8th grader. She's very excited to go back to school because she has never been in the building. And my son is in Bot Hills 4th grade. Thank you.
Thank you. Jill.
Hi, my name is Jill Dunkel. This is my second year in the PAC. Have not been to a meeting in a while, so I apologize for my absence. I have a daughter going into 9th grade and a daughter who's a senior.
And Margie.
Hi, I'm Margie Saw. I've been on the PAC for a few years. I have a 11th grader and a daughter who's going into 4th grade at Blue Creek.
And I'd also like to recognize Jane Dawson. Jane is my assistant. She is on the PAC meeting as well. And
hello, everybody.
Great. All right, super. And anybody else here who I missed?
I don't know if you called me, Mr. Core. It's Michelle Belvedere. I was having some audio,
Yeah,
but
I did, Michelle. Yes, it's great to have you here. And Heidi, do you want to introduce yourself as well here? As you know, you are on the call as well, and very much an integral part of what we're doing here.
Hello, my name is Heidi Weber. I am actually with Capital Region BOCES, but I am working very closely with the North Colony School District this year on communications, and I have a daughter who is headed into 6th grade in the district.
And thank you. And I can just see we've been joined here by Paloma Liuzzi. Paloma, do you want to introduce yourself quickly here? I think you're muted.
Hi, good evening. I'm Paloma Luisi, a parent of a Loudonville incoming 2nd grader and probably a Loudonville kindergartner. I am a public health research scientist. I study public health at the University of Albany, and I work for the Department of Health.
Thank you, Paloma. So we are very fortunate. We also have Ryan Moore on here as well. Ryan is our from our IT department and also is obviously integral for us this evening. So Jane, why don't we go right to the presentation? So thank you very much. So I'd like to start off here, first of all, with the good news. The good news is truly good news. North Colony is committed to a full return of in-person instructions for all grades 5 days a week. So that is going to be the main mode of instruction offered to all our students in North Colony K-12. It's a 5-day-a-week commitment. It's back to full school days. And we're very pleased to be moving in this direction. We were intending to go in this direction all along, but this is our commitment. We are back to a 5-day-a-week instruction of full days. So that is the good news that we want to share first and foremost this evening. So let's go to the next slide here. So the 2021 school year in our region, and as you well know from the national news, COVID-19 is always changing. Our plans must be fluid. And that is really the case that it has been throughout our experience in COVID-19. The vaccine will do what it is, the virus will do what it is going to do. And we are very concerned about the variant, the Delta variant right now, and we'll be talking about that briefly here. But I also want to assure you here that North Colony and other districts in the Capital Region have been working with Capital Region BOCES, the Albany County Department of Health. And actually, we've been working with a regional planning group that involves Capital Region BOCES, Warren, Saratoga, Washington, Hamilton, Essex BOCES, and Questar BOCES, which encompasses Columbia, Greene, and Rensselaer counties. We've been working with selected superintendents. I'm on that group, as well as the county health department commissioners to continue to meet and coordinate for fall 2021. So we've had 3 meetings of that group. We will be meeting again on Monday. Our regional superintendents group in Capital Region, the 24 of us will be meeting tomorrow on Friday. So we are still in the planning stages, but even though we have not made finalized decisions yet, I want you to know that we are working very hard on that. We are working on it as a region. And I also want to be able to give you a sense here of how the work is progressing in the directions we're headed toward. So I think another big development, and you may have seen this in the news, but last evening, we as a group of regional superintendents were informed that we are going to receive no definitive guidance from the New York State. That's from the governor's office, not from the New York State Department of Health. We were promised on that, that we would be receiving this. We were told that it was imminent and impending, but we have not received that guidance, and we will not be receiving it according to what we've been told. So therefore, we continue to work as a region. We are working collaboratively. We are working on the procedures, processes, and protocols for the return to schools. So this evening, I'm going to tell you that are no final decisions. And essentially, Dr. Zucker, who is the New York State Department of Health Commissioner, said that since there are no executive orders in place and since the governor does not have executive order authority anymore, that there will be no guidance coming from the New York State Department of Health. Concerns have been raised by the New York State Education Department about the lack of that direction, but Dr. Zucker said that we should follow the CDC guidance and the local Department of Health guidance. So that is the direction that the school districts in the region are proceeding toward right now as we speak. So let's go to the next slide. So I mentioned previously the Delta variant, and the Delta variant currently complicates matters. So what do we know right now? We know that there is an uptick in infections, and I believe tomorrow, when the county does its reporting out, you will see that there are a lot of infections. And even though the day was not completely over, we were at 60 infections reported in the county as of this afternoon. So that number may increase. So there's a concern about the uptick, and that uptake is occurring nationally, and it's certainly occurring in New York State and in particular in our region. The recommendations that the CDC, that the Academy of Pediatric Physicians, and that the Albany County Health Department are making, those recommendations evolve. They evolve particularly as the rate of infection increases. And CDC guidance is directly correlated to the rate of infection within an area here. So we certainly will continue to meet, but absent no official guidance from New York State Department of Health, the region continues to work collaboratively and plan collaboratively. So let's go to the next slide. So more about the Delta variant. So the Delta variant was first identified in the US in March. And right now, according to the CDC guidance, 81% of the infections are linked to the Delta variant. There are Delta variant infections in this region. It is much more rapidly spread. It's also been shown, you might hear the term breakthrough infections, and breakthrough infections are those that are occurring currently in vaccinated individuals. The good news on vaccinated individuals is that they are generally avoiding becoming really sick and facing hospitalization. So that's the good news there. But it's important to note that viruses are part of science, biology, chemistry, physics, and viruses change through mutation. And this is directly from the CDC. So as the virus progresses, new variants are expected to occur. That's the expectations. Sometimes they appear briefly and disappear, but they persist. And this one is persisting. And we've had multiple variants. I know of at least 4 that have been documented in the United States during this pandemic. They've also been documented throughout the world. Viruses also change. They become more diverse. So what our public health experts and our epidemiologists do is they monitor the changes. They look at the changes in the spikes on the surface of the virus, and that tells us something about how the virus is spread, about its whether it's more severe, less severe, and so on. But that essentially, that's how scientists study. That's how they learn how it might affect, how it will spread, and how sick people will get from it. And in the presentation, which we will post on the website subsequently, there is a link there to coronavirus variants, and there is a tracker there where you can look at the spread of the Delta virus throughout the country and click on the various regions to see to what extent the Delta virus is in that region. So that really is, if you will, that is the new variant that is giving everyone great concern at this point in time, and is causing the current uptick in infection. Let's go to the next slide, please. So what is our objective here? And this is the objective of North Colony, and it's common to the objective of every school district in the region. We're going to look at enabling a full return to school. That's our commitment. And we're forging ahead. We're using what we've learned over the past 18 months, incorporating that in our plans to return as we make them here. And we are committed. Our commitment is providing a learning environment that keeps our students safe and healthy and in school. So that's where we are. And that's our commitment. Let's go to the next slide, please. So when we look at COVID-19 mitigation strategies, we're going to go back to what we know, and we're going to use the guidance from CDC. We're also going to use the guidance from the American Academy of Pediatrics and the Albany County Department of Health. And so if you look at CDC and you look at guidance from the various public health agencies and the American Academy of Pediatrics, their focus is on getting students back into school and keeping them there. So what they've implemented here is a series of what they call tiered mitigation strategies. And one of the biggest struggles that we had last year was the 6 feet of social distance. To adhere to 6 feet of social distancing, reduce the capacity of schools to have our students in person. So we were able to have our K-6 students in school for a full day every day last year. Our 7th and 8th graders came in for a half day daily and finished the day in remote. And then our high school students, our students in 9-12, alternated days in person for a half day and being completely remote for the day. So that's basically where we are. And so I think the key point here is we're looking at 3 feet of social distancing when feasible. We are looking to transport our students on a bus. We would be looking for seating charts on a bus, assigned seating on buses, seating charts in classrooms, keeping bus windows open. But we would be looking at, transporting as many individuals who want to be transported to school on a bus. So busing will not be an obstacle to keeping students back in school. When on buses, students will be required to mask, and that is a federal requirement on public transportation. So that's an important point to note. In addition to that, where possible and when possible, we are still encouraging our families to transport students to school. And that would lead to lesser crowding on busing. But busing will not be an obstacle to our return to school. We're going to continue to implement our cleaning and hygiene protocols, and our custodial staff was very diligent and effective at that. The screening and attestation process most likely will return in the fall. We want to know when people are not feeling well, and I think an important component of this is that when staff and students and anybody who works in the school are not feeling well, that they stay home. And I think many of us have grown up with the notion here that you power through. We power through at work. We power through at school. But that's no longer the case. The wise thing to do is, if you're not feeling well, and even if you're not really sick, but you are symptomatic, you must really stay home. And that's going to be important here. I think leaving windows open when possible, increasing ventilation, MERV 13 filters, they are installed on our schools. And there is, quite honestly, a strong likelihood of students and employees wearing masks per CDC guidelines. And that is the recommendation of the Albany County Department of Health, given the current rate of infection in the capital region. So again, I want to emphasize, these have not been finalized yet, but this is really a preview of what is most likely to come. So I think I do see a question, Michelle. Is there a recommendation requirement for 3 feet? And yes, Ms. Fields has answered that. We have room with the 3 feet rule for all our students. Yes, thank you. Can we go to the next slide, please? So there is another question out there about completely virtual learning and will it be offered? So let's go to the next slide here. So current modeling is based on the CDC recommendations of having provisions for students who are immunocompromised or have direct family members who are immunocompromised in the household. And it should be for documented medical reasons. All right, so those are, that's where perhaps a virtual learning option would be offered. We and the other schools within the region are exploring the possibility of participating in the remote instructional model that's currently being coordinated through Capital Region BOCES. And very shortly, we will be getting more details about the model, and we will be surveying North Colony families to see if those who have documented medical reasons would be requesting this regional approach to virtual learning. So I certainly anticipate having more information available for you shortly on that, but we'll be going forward. So Brett, with regard to, there is a question with regard to masking. So I am not going to go into finalized recommendations yet because the region is still working on it. But I think the indication here is that that's what you should be doing in schools, especially given the increased rate of infection due to the Delta variant. So we will be certainly specifying exactly what the masking requirements are as we go forward. Go to the next slide, please. So I think the moving forward part of it is that we're continuing the work as a region to develop a tiered mitigation protocol that includes guidance on the following. And that guidance will be developed on masking, on social distancing, what screening protocols will be in place. Another important component of the return to school could be testing. Particularly among unvaccinated populations. The counties have received substantial funding from the federal government to conduct testing in schools as a precautionary measure and as a prevention measure. Other protocols such as cleaning and hand washing, specifying transportation protocols, athletics, extracurricular, music and performing groups, cafeteria and feeding students. And I think the important thing to note is that these processes, procedures, and protocols may actually be linked to local infection rates. So Lisa, you just asked a question here, will the school host a vaccination clinic for the 5-12 kids when that vaccination becomes available? And the answer is yes, we would be happy to do that. In fact, we just offered one today from 3 to 6 over at the middle school. So that's important. So Sujatha has, in the middle school, some kids are eligible for vaccinations while others are not. How will this issue be addressed? Okay, so first of all, we are planning to have all students back K-12. If there's any kind of differentiation based on vaccination, that will be covered in further guidance. Speaking of vaccination, is there data out there as to how many school-age kids in our district have been vaccinated? We can pull that data and we will take a look at it. Some of our preliminary data, and this goes back to the end of school to May and June, indicated that we knew that our seniors who were graduating at that time, the number of individuals who had had at least one shot was that was pretty good. Music, especially singing instruments, we will have guidance on that, Jenna. That's that will be forthcoming. I know Deborah Keogh, our district music supervisor, worked with the region, and they were very eager to adopt her guidance, and that guidance moved the social distancing from 12 feet to 6 feet. We had bell covers on our brass and our woodwinds, but in any case, we will be getting that. Karen, do you have updated percentages for staff vaccination levels? The updated percentages, we believe it's at least in the 80s and maybe close to 90% of staff who have been vaccinated. I understand that my voice sometimes fades out, and I apologize for that, so I will make sure that I stay closer to the mic. So,
I'm sorry, there was one question that came in about people who are vaccinated and what happens to people who are vaccinated if there should be a quarantine in the future. So I can talk about that process if you would like.
Yeah, that'd be great. Thank you.
Sure. So currently the process is if we have a positive case, we identify the contacts in the school, as you well know, we submit all of those names to the county. If someone tells us that they're vaccinated, we still submit the names to the county, and we note in a particular column that the person has reported they are vaccinated. The county then confirms the vaccination status of that person, and then as of right now, that person does not have to quarantine. And so the county lets them know that. So that's important to know. And that is the process we use right now. So we report everybody to the county, but we specifically reference those who are reporting vaccinations, and then the county checks and then informs us that they don't need to quarantine once they confirm the vaccination status.
And I think it's important to know too, I know there's a lot of specific questions here that exist right now. We are in the process of continuing to develop our guidelines. So I think that's important to note. And tentatively, we do have a meeting scheduled for next Thursday. I would assume that it would have more to say at that point in time. And the guidance right now, whether you're vaccinated or unvaccinated, is 3 feet of social distance. So let's move to the next slide, please. So here's the good news. Okay, so the first day of school, everybody's back on Thursday, September 9th. Tuesday and Wednesday, September 7th, September 8th are our traditional staff development days. So we're back in school Thursday, September 9th. And let's go to the next slide. We'll take a look at the schedule here. So the schedules for the 21-22 school year are essentially as follows. The high school 7:10 arrival. School day starts at 7:35, dismissal at 2:17, depart. Buses depart at 2:25, late buses at 4 p.m. And for high school students who are staying late, they will ride the middle school buses. Middle school, 9 a.m. arrival, 9:10 start in the day, 3:55 dismissal. Buses depart at 4, and the late middle school buses at 4:40. And early elementary, that would be Blue Creek, Bout Hills, and Southgate, 8 a.m. arrival, 8:05 start, 2:50 dismissal, 2:50 buses depart, late bus, 4 p.m. Each elementary has 2 late buses, and late elementary, Forts Ferry, Latham Ridge, Loudonville, 8:35 a.m. arrival, 8:40 start, 3:20 dismissal, buses depart at 3:25 p.m. and the 4 p.m. for the late buses. Okay. Mr. Chamberlain, Ms. Myers has a question here in the chat. When will middle school staff be available for extra help?
So that is one of the pieces we're working through. At the late end of the day, the traditional after-school time does make the end challenging. Some students may be able to stay for extra help, but that is still one of the pieces we're working through to find time to be able to address students' individual needs to be able to get extra support. So that's something we'll have to get back to you on.
And what about clubs?
We will have clubs during the school day. We're going to have a schedule on top of the schedule that allows all students to access clubs. And we do intend to have intramural sports. Exactly how we're going to have those, likely in the morning is when those would take place.
Thank you, Mr. Chamberlain. Okay.
Can I just add there? Yeah, Brett, middle school students can take the high school buses so there's equity of access, so they can get to school early. And we will have, they can come to school early if they're going to be engaged in one of those activities, be it intramurals. There are some students who have what's called a 0 period class that starts before our traditional classes will start at the middle school.
Thank you, Mr. Chamberlain. Could we go to the next slide, please? So the tentative date for the next PAC meeting is Thursday, August 12th. I'd say it's most likely that we will have something to add at this point in time, but we will hold a meeting if we have new information to share. We don't want to bring you out just for no reason, but I'd say it's highly likely we will have this information to share, and we will send out a notification on whether or not a meeting will be held on Wednesday, August 11 by 5 p.m. At the latest. And at future meetings, I know, Mr. Chamberlain, you're going to be talking about middle school schedule specifically with middle school parents at some point, but we can certainly address the issue of the middle school schedule at a future meeting. Can we go to the next slide, please? Okay, so these are resources that we have. We're going to include one more too, and that's a letter from the Albany County Department of Health. But this is the guidance. You can click on this. This is the guidance for COVID-19 prevention in K-12 schools provided by the CDC. And this is the American Academy of Pediatrics COVID-19 guidance for safe schools. And you can click on those. Those are very informative documents, and they are guiding the return process to school. And last slide here. And any questions, just send them to communications@ncounty.org. So at this point in time, that ends the presentation. Do we want to come back? Why don't we come out of the presentation and the screen sharing and see if any individuals have additional questions here. So we are working regionally. We are working collaboratively with our partners, and that would include partner school districts, partner superintendents, partner health department officials in the various counties in the region. Always great to have you back. Thank you, Jennifer. Appreciate that very much.
Yeah, just to reiterate what Jennifer said, thank you so much for your hard work throughout the summer and getting us ready for school. We're all excited to have our kiddos back in, so thank you.
Yeah, thank you, Stephanie. Appreciate it. Will middle and high school children be able to use lockers this year? I'm imagining they probably will. And we will be talking more specifically about meals and cafeteria protocols, but again, CDC stresses that there are recommendations, and we'll do the best we can, but they should not be obstacles to kids returning to school. So we will be working to provide the distance environment as feasible and still manage to deliver meals to students throughout the day and maintain our school schedule. Well, thank you all for coming together and join us. The Bout Cafeteria, yes, or the Bout Cafe. If we, so that is a great question. We're working to get it ready. If it's not ready, we have a plan to be able to deliver meals to students in the classroom. So we're ready to go. Margie, what additional help and resources will be available to those students who are academically impacted by hybrid learning? So we want to make sure that, first of all, that, we don't assume that everyone has learning loss. And I think, that deficit thinking is something that really is, it's not fair to kids, quite honestly. Kids have learned a lot. They've done a lot of great things. And quite honestly, yes, there's been hardship and, there's been an impact on learning. But I think what we would do here in that case is this: we want to bring students back. We want to, first of all, welcome them back and make them feel warm and welcome to school. And I think, that is a significant, important part of the return to school. Then subsequently, we will be taking a look at how students are doing academically. We are fortunate to have additional federal funding, and we've used that federal funding to provide additional support individuals in the various schools, particularly in the areas of reading and mathematics. And we will be here to provide that support either through small group instruction or individual instruction to those students who need it. Ms. Skills, do you have anything you want to add to that at all?
Yes, I would just say that our academic supervisors have been working on this all summer. They were working at the end of last year to prioritize the standards, to line them up, and then have been working with the teachers to prepare them for when students come back, how we can assess students in a way that isn't like day one, here are all the tests, so that we don't add to their stress, but be able to check in and see where our students are and then build from there in a very recursive way. So they have been working very specifically with them on that.
We do have a question, and maybe Mr. Deneen or Ms. Skills would answer it. Kindergarten assessments for new students.
Well, right now we will be sending out a survey to all parents for incoming kindergartners. That'll help with the initial screening. But we do have kindergarten assessment as far as numeracy and literacy when the students do come back to school. So those are pieces we were just talking about today with principals. So yes, those are in place and will be there. Again, some before school, such as the survey, and some after school starting.
Yes, and we will make more information available to parents about that plan. Thank you, Margie. So at this point in time, if you have additional questions, please feel free to submit them to communications@ncounty.org, and we will do our best to respond to questions related to the reopening. So I appreciate all your support. Thank you. Thank you, Ian. Thank you, all of you, for your dedication as a Parents Advisory Council. It's always greatly appreciated. And thank you very much. And we'll keep you posted. Thank you. Have a good evening. Thank you all. Greatly appreciate it.
Thank you, everybody.
Thank you.
Thank you.
Bye.